With so many people now worrying about a worldwide economic slowdown, is it time to start swapping into the stocks of rapidly growing companies that don't need a strong economy to do well? Take DexCom, DXCM, a $3.3 billion medical device company that makes cutting-edge continuous glucose monitoring systems for people with type 1 diabetes. About 1.5 million Americans have the disease. It's essential for them to keep track of their blood sugar levels on an almost constant basis. The old way to do that was by pricking your finger. You're driving your car, suddenly you're pricking your finger. I mean, DexCom makes a sensor that you can stick on your skin for an entire week and then transmits your blood sugar data to a wireless receiver. Yesterday, DexCom reported a very strong quarter. And while the company's not yet profitable, its revenues came in much higher than expected, up a magnificent 64.2% year-over-year, probably about the highest we've seen this quarter. And management raised their guidance for next year. Plus, DexCom is poised to turn a profit in 2015. They've got good growth in pediatric glucose monitoring, which the FDA only approved this past February. And they're taking market share from big-cap competitor Medtronic. In response to these results, the stock shot up more than $5 yesterday, 13.5% gain, tacked on another 2% today. Now, DexCom has one of my favorite kind of business models, a razor blade model. You buy their glucose monitoring system, and then every week you need a new patch. Wow, that's fantastic. That's a good source of revenue. In the past, these continuous monitoring systems haven't been as reliable as the old finger pricking method, but they're getting close. The company recently released a study which showed that their system it's almost approaching finger prick accuracy exactly. And while Medicare won't reimburse for Dexcom's products or anything like it, a growing number of insurers are on board. I'm talking about Aetna, Cigna, Humana, UNH, WellPoint. Plus, Dexcom has some exciting new products on the way, including a partnership where an insulin delivery system will be integrated with their monitoring platform and a mobile app that measures all of your diabetes data, sends it to whoever you like. Your doctor. This stock is now up 219% since I first got behind it in March of 2011, and it's rallied 39% since we last spoke to the CEO just this past May. That's a huge run. Okay, I understand if you want to take something off the table. That said, if secular growth names are coming back into vogue, and I think they are, this stock could have much more upside. Let's check in with Terry Gregg, the CEO of DexCom, find out more about the quarter and where his company is headed. Mr. Gregg, welcome back to Mad Money. Good to see you.
Hey, Jim.
Good to see you. All right, last time we talked, and you had a device that was on an iPhone, and it seemed about as small as it can get, but it isn't.
No, that was just the start, and right now I've got the watch.
Okay.
And this is the easiest way.
This is the wearable that makes sense.
This is the wearable that makes sense. I mean, you can simply, at any time during the day, instead of having to take something out of your pocket, you look down, you see the time, and then you see your glucose and the trending arrow. Is it going up? Is it going down? Is it staying flat? We really think this is a game changer.
And it's within 5% of a finger prick, which is obviously not something that is easily done when you're driving.
Exactly. But it does tell you speed and direction of glucose, which is what all people with diabetes want to know. What's going on?
Well, I thought it was interesting because there was a Wall Street transcript this week that we got, an interview, where you were talking about a gentleman apparently who had a hypoglycemic event while driving. This could prevent that.
Absolutely. I mean, every time somebody gets behind the wheel of a car and they have diabetes, they need to know what their glucose levels are, and they need to know if they're trending up or trending down, because hypoglycemia, low blood glucose, has cognitive impairment complications.
Right.
That's what happened to this gentleman. He rendered himself unconscious behind the wheel of a car, ran into a gas station, blew everything up. Luckily, he was saved.
Right. Now, one of the things that I found that was outrageous, and I was going to start with it, but I like the device story, but Medicare doesn't cover this?
Not yet. Not yet. So we've got two prongs here.
There's 500,000 people who are in their 60s, 70s, 80s.
And there's plenty of data to support the utility of CGM in that age population. Okay. So two-prong approach. One, we're working with the Food and Drug Administration to get a non-adjunctive claim, which is one of the barriers with Medicare. Okay. And secondly, we had two U.S. senators last week introduce a bill specifically for Medicare coverage of CGM. And so both of those are moving forward. Can't tell you when it's going to happen. Can just tell you it is going to happen.
Okay, I've been looking into Affordable Care Act coverage for people, and the deductible's very high. Will people be able to afford this device?
Yeah, if you look at the ACA rules, what they say is that if a product is covered under usual and customary on a commercial insurance basis, then ACA will cover it. Well, 98% of our patients have some form of commercial coverage, so it should be covered under those same rules.
Okay, Terry, the literature says that the company that you actually sold another company to is a competitor. but they're nowhere near. Now, give me an objective benchmark that tells me why they're nowhere near you guys.
Well, I just don't think their technology from its root basis is ever going to achieve what we're able to achieve. So going into the American Diabetes Association meeting, our technology G4 versus their latest technology, we were 50% more accurate. Now you add our latest algorithm, and we've increased that even more dramatically. So I just think that in terms of performance, accuracy, patient acceptance, we are what patients want, need, and trust.
Well, I got to tell you, you've built an amazing company. I urge people, go to the website. There's also an interesting box where if you feel like the people with Medicare should get this, you can also go right through there and say that you believe they should, as I did when I saw it. Okay, this is Terry Gregg. He's the CEO of DexCom. It's been a huge winner. I think it stays that way. Stick with Cramer.